Hello, Culture Matters podcast. Before I introduce you to our guest, here's a quote I picked just for this episode. If you have a garden and a library, you have everything you need. Marcus Tullius Cicero. Today, I'm welcoming back a friend of the Culture Matters podcast, Dr. David Yerkes. Listen to episode 121, season 11. Totally different conversation between Dr. David Yerkes. This is a good friend of mine I met a few years ago that is always one call away with an ear and some insights into being in the best peak health, both mentally, emotionally, physically. So today I want to learn a little bit about what you mean by holistic medicine and how to approach even qualifying, or if the audience is interested in interviewing and looking in the world for that at home counsel in the space of like doctor, coach, in the space in the context of holistic health. So hope I didn't butcher that too bad, brother.
No, excellent. Yeah, I'm excited to talk about all this stuff. This is stuff that I really geek out on, so it's fun to talk about, and I'm really passionate about it. So I'm excited to have the conversation.
Have you seen an uptick over the last few years, even the last decade or so, in people that have an interest in having almost like a physician on staff or at beck and call? I'm curious about that culture.
So I have seen an increase in not only an interest in it, but also from the patient side, but I've also seen an interest in it from the physician side. And probably the one of the biggest drivers of that is just the frustration that especially primary care physicians feel with not being able to spend enough time with their patients and feel like they're beholden to insurance companies, to kind of essentially check a bunch of boxes, and the insurance company is essentially a middleman between you and the patient. And so a concierge or direct care type of arrangement allows that physician patient relationship to kind of be mended, and really allows you the time, because a lot of the, if you go back to looking at what causes a lot of the illness nowadays, it's things that really kind of you want to be able to put some time into discussing with your patient, or and vice versa. So there is a lot of frustration with primary physicians, but particularly, but also a lot of physicians feeling like they're running an assembly line, and being kind of pressured by really by insurance companies to kind of do a lot of things, or maybe restrict access to things that the patient needs. And so the direct care model or the concierge model kind of throws the insurance company to the wayside, and it goes back to that doctor patient relationship. So there is a lot of interest from both parties now, I've seen, and some of that may be my bias because I'm interested in it, and so I'm looking for kind of that kind of information on that kind of thing and everything like that. So I may be biased in the fact that it seems to be growing, but I really do believe that it is growing, and there is a lot of interest. I think there's a huge opportunity for it to continue to grow. It's affordable for patients, but it's also allows physicians to kind of break free from those shackles of the system, if you will. And it really is excellent for the people that are patients of direct care or concierge doctors, are typically very, very, very happy and love the model. They're the biggest advocates of it. Now, what I'm doing is slightly different. I'm not doing a direct primary care model at the moment. I'm open to it. I'm curious. I would say I'm DPC curious, but I do a concierge type of practice, but concierge in the way of essentially it's not an insurance model. It's not an insurance-based model, so it's a cash pay model. But I'm focused more on health optimization and longevity, which unfortunately, preventative health and health optimization looking forward, a lot of these things are not covered by insurance. They'll cover you if you break your hip, but they won't pay for the 30 years of interventions and testing and counseling and coaching and things like that, preventative medicine that takes to prevent the hip fracture to begin with. So my idea of the way medicine should be is, like kind of like Ben Franklin said, an ounce of prevention is worth a pound of cure. And that's probably an understatement when it comes to medicine. And when it comes to the things that we see that we know take out a lot of people: cancer, cardiovascular disease, neurodegenerative disease. We know that there's things that we can do to significantly reduce your risk of developing these problems. And metabolic disease is probably the fourth one, which includes diabetes. But metabolic disease is a player in all of these other things. It's a player in vascular disease. It's a player in neurodegenerative disease. And so, there's a lot of things that we can do. Genetics play a role, but there's a lot of things we can do physically to really significantly reduce our risk or delay the onset of a lot of these things and improve our health span and not just our lifespan. And our health span is essentially the amount of time that we live well, that we thrive. And so most people really wouldn't care how long they live if they're not living well, right? But the idea is to live well longer. One of the things people say is die young at a ripe old age. So you stay young, feeling young until it's time to die. And that's the goal. And extending the number of years, if you focus on the health span, the length of time, the actual years tends to kind of follow along with that. So
is this the
that's
difference
kind of what
between a proactive and a reactive? And the reason I ask that is, it sounds like if insurance is covering things after the fact, I'm reacting to those things. And the things you're talking about, this health span, is about a proactive approach. Am I on under this or no?
Those are the exact words I like to use: proactive. And I tend to that's kind of my nature. I tend to, even when it comes to like organizational things, it seems like one of the things that's frustrating to me in a if I'm in a large organization is constantly just being reactive and never being proactive about things, and so that's just kind of in my nature anyways. But especially when it comes to health, we should be proactive about it. And we know enough now to know what we could be doing to be proactive. But the thing is, it kind of goes against our human nature to be proactive. It's just the way we're wired for some reason. So it does take, sometimes it takes, testing to kind of show somebody, hey, here's something that's happening already. You might not see the end result. You might not have a heart attack for another 20 or 30 years, but we can do some of this in-depth testing right now and kind of see, oh, look, there's some risk factors here that we want to look at and control and try to mitigate to where, in 30 years, I mean, you're not ending up where you don't want to be. So it does take a little bit of a forward thinker and somebody that is willing to, as far as a patient goes, somebody that's willing to how do I want to phrase this? You can't just be living your life laissez-faire. You kind of have to be willing to be intentional about life, and kind of proactive is another word. So I like the word intentional as well. What I like to do is kind of look at the future. Like, where do you want to be? Say, where do you want to be when you're 80? What do you want to feel like and look like? And, how do you want to feel? And then kind of go back from there and say, okay, well, this is what we're going to need to do in order for you to get there. I think one of the hurdles is people don't realize what's actually possible if we do all the right things, how dramatically better we can be in the future. But it does take a long time. Like, it takes a long time for these diseases to develop. It takes a long time for vascular disease to develop, and dementia, and all these things that kind of do end up happening in our, later decades.
Are there ways that I can slow down dementia?
There are ways that you can definitely reduce your risk of dementia, and there are things that increase your risk of dementia. There are genetic there are genetic susceptibilities, and then there are also metabolic things that can increase your risk of dementia. But there's also things that you can do to mitigate those risks and decrease your risk of dementia. I mean, the magic pill is exercise, and we can get into the details on the best way to do that, for each part of your health. But it's essentially a whole, you use the word holistic at the beginning of the show, and that really is kind of the approach you have to take, because there are multiple facets that we kind of have to look at as far as our lifestyle goes. Unfortunately, right now it looks like there isn't really. There's a lot of people that are focused on molecules when it comes to longevity and health, and there's some promising things out there, but I kind of look at it as the lifestyle stuff that we know that really makes a difference and really moves the needle. That's the fundamentals. That's the things that really we know. And that probably moves the needle 95%. And then some of these other molecules, and like NMN and NR and resveratrol, which may or may not even work.
What is that?
So resveratrol is the molecule in grapes that people believed extended lifespan. The thing is about that, the study that was done was not able to be replicated. It was done in mice, and it wasn't able to be replicated. So, but there's been a lot of resveratrol supplements sold since that original study was done.
Wow.
But the point I was trying to make is, it's kind of like when you're looking at trying to find these tricks and biohacks and these little things that you think are going to make a difference. It's almost like digging through a pile of hundreds to try to find a dime. And the pile of hundreds is the lifestyle. It's your sleep, exercise, your nutrition, and your mental health. And those are what I call the core four. And so, are there molecules and supplements and things that you can take? I mean, I kind of classify supplements under the category of nutrition, because you should be supplementing things that you need that you're not getting from your diet, and we test for that and we look at all that. And so we do metabolomics, and we look at your nutritional status, and we do about 125 biomarkers to look at where you're at on all those factors. So I look at supplementing should be primarily to make sure you're in the right ranges. You can supplement too much, you can take too much of something, and you can have not enough. And so that's why we look at all that. But really, there are some things that you don't necessarily need to test for. I think creatine is a very, very promising longevity supplement that probably most people should be taking. Most people should be trying to get enough protein. So some people will take, kind of supplement that with some whey protein or something. And there's some other supplements there's several other, supplements that aren't necessarily, you wouldn't necessarily fall under the category of, nutrition, like you would be getting it, like you're just supplementing it because you didn't get it from your diet. So there are some other things that you can do, but I feel like those things the effect of those pales in comparison to what we know. For instance, having a very, very high VO2 max, which is a measure of cardiovascular fitness, decreases. And I heard a statistic. I think it decreases your all-cause mortality, meaning your death from all causes, by about 500% or fivefold.
Wow.
Having a very high VO2 max. So,
How do I build
those
that?
are, what's that?
How do I build that? Let's start there.
Well, okay, let's talk about that. So
Can I
first you have
build
to know
that
where you
walking on
are.
the treadmill? Because I don't
So
think
you're
that
probably not going to
builds it.
increase your VO2 max a lot by walking. However, walking is one of the best things you can do. Walking is so I let's talk about exercise for a minute. So I categorize bodily movement into three kind of categories, or maybe four. We'll say four. So the first category is just daily bodily movement. I'm literally like what I'm doing with my hands right now, bouncing your knee at your desk, walking around the house, walking around the garden, walking on the treadmill. The way that we quantify that is steps. You've heard step counts, right? I'm sure you
Yeah.
have. So that's how we quantify that, but it's more than just steps. It's all of your bodily movement. And that is probably where we really burn the bulk of our calories from movement. Most of our calories actually are burned just staying alive, metabolic processes. But then if you're talking about how many calories you're going to burn from movement, it's going to come from your NEAT, non-exercise activity thermogenesis. So walking, playing recreational sports, I would categorize in that. If you're going to, play a softball, you're going to go play softball or something like that. So that is your daily bodily movement. So that is extremely important to longevity. It's been correlated with a longer lifespan, and it's also important for actual, weight management. So if you're somebody that's trying to lose weight or looking for a way to lose weight, the bulk of the calories that you burn in a day are not going to come from your cardio. You're running on the treadmill or lifting weights. It's going to come from how much you move around during the day. And so that's daily bodily movement without getting really, really far into the weeds on that. The second category is cardio. And cardio and weights, I actually categorize as exercise. The first one I don't really categorize as exercise. Cardio and resistance training are categorized as exercise because they have a specific performance goal in mind. The goal is not to burn calories or even body composition, even though they will give you some benefits in those departments. From a health and longevity standpoint, the goal of cardio is to have better cardiorespiratory fitness. Okay, it's to live longer, because cardiovascular disease is the top killer. And
Wow.
one of the ways you stave that off is cardiovascular fitness. But cardio also improves it decreases your risk for a lot of other things. Dementia. It causes your brain to it increases a molecule called BDNF, which is brain-derived neurotrophic factor, which causes new connections to form in the brain, decreases your risk of dementia. So exercise decreases your risk of cancer, a lot of other things. So cardiovascular fitness is important for overall health. We don't do it to burn calories specifically. So, like, for instance, one example and one reason for that is, and I don't like comparing food and calories and exercise, but just to give you an example, if you were to go eat a granola bar, it might be 150 calories, right? And then if you went and tried to run on a treadmill, just to burn 150 calories, and the mindset, it's a lot. It's actually quite a bit to burn 150 calories on the treadmill, right? So if you're looking at, yes, but if you look at cardio as, hey, I have a goal here for a cardiovascular performance goal, it's a little bit different. It changes your mindset and actually makes it easier for a lot of people. Are you tracking what I'm saying?
So
if you're getting on the treadmill,
you mean,
yes,
like dopaminergically, the goal, like if I like to feel good about the outcome.
Right.
like
Versus
the
punishing
dopamine
yourself for
spike of
eating.
the positive mental
Yes.
attitude that comes from looking at it as not a calorie count, because that can be demotivating. Is
Yes.
that what you're saying?
Yes. And it is demotivating, and it's,
I'm
when you're
less
just
likely
trying
to
to
do
burn
it again.
calories, it feels more like punishment than it
Yeah.
does like, working towards a goal. Right. So,
Would you find that people will be less likely to continue to make it a habit if they're not focused on it in the right philosophy? And the right
absolutely.
philosophy would be look at it as a part of this lifestyle to enrich your cardiovascular health. And like every time you do it, you've checked that box in a positive. You've added more days on the planet. You've added higher quality. Don't look at it like 100 calories, 500 calories, 300 calories. Then it's going to be less likely that you'll continue to do it. Am I kind of on the right
Yes,
track?
absolutely. Yes, that's exactly right. Speaking of mental health, exercise also improves your mental health. It also improves your focus. It helps you perform better cognitively, so it improves your cognitive function as well, just as another added benefit. So if you're doing it for the what I would say the right reasons, if you're doing cardio for cardiovascular health, then it actually is better to it's easier to sustain that habit, and you don't feel like bad for missing, and it's less of these highs and lows emotionally.
Mm.
So really, most of if you're looking at a weight management program, which not everybody needs to lose weight, but the people that do tend to look at exercise as a way to do that. And really, most of the time we're just consuming too many calories. And there's other things that go along with that. And that's one of the things we do in our program. We talk about all the different types of nutrition and the types of food you can eat and how that affects your body and how it affects your microbiome, how your microbiome affects, you know, satiation, and all these things like that. So we talk about all that when it's not just about counting calories. It's about the whole picture. But the point is, um, cardio is for cardiovascular health. Now, the next type of exercise, the third type of exercise, is resistance exercise. And I'm really passionate about this one because I think not enough people do it, and I don't think enough people realize the benefit of it. And a lot of people don't realize the drawbacks to not doing it. And I'm probably biased toward this because I work in the hospital and I see so many people come in every day that can't even get themselves up out of bed. I mean, people that are relatively young in their 70s, you should be able to walk under your own strength in your 60s and 70s, and I think people, it's shocking. But the thing is, like, if you can't and you go home and fall and you get a hip fracture, which we see all the
Horrifying.
time, the mortality rate for hip fracture is 50% in 1 year. So that means half of the people that have a hip fracture will die within a year. So this is
Wow.
something. So frailty, what I'm saying is we're trying to stave off frailty. So frailty not only reduces your lifespan, it also reduces your health span, right? Because if you're frail, your quality of life is very poor. And most people, when they're getting into those decades, are frail, but they don't have to be. There's numerous examples of people that have even started lifting weights or doing resistance training in their sixth and seventh decade and have made a significant improvement. But um, but frailty is one of the things that really decreases people's quality of life. And then once you're in the hospital with a hip fracture, what do you do? What do you think are the options? You're 73 years old, you've fallen and had a hip fracture, you're frail, you can't get up out of bed on your own. What's the next step for you?
It's someone to care for you, I would think,
Yeah,
which is
but how
mentally
many
debilitating.
someone what if that someone has a job or has to work full time?
No, then you have to go through one of these third parties, I would think, someone external would have to help. It would cost money and resources, and you become
It's not
this is
covered
just
by
me guessing,
insurance.
like a theoretical, yeah, some kind of
So you have to go to
on
a
someone else's
rehab.
balance sheet, you become a liability, I would think. That's a
Yeah.
scary place to be if you think about that.
Yeah. And you also, and you know what ends up happening is a lot of these people don't have any resources, and they end up having to go to a rehab or sometimes a nursing home, which nobody wants to do. I have yet to meet anybody that
Why?
wants to go to a
Why?
nursing home.
Isn't a nursing home one of the most enjoyable, safe, fun? It's not really like it is in the movies, right?
No, I don't think it is most of the time. I think most people that work at nursing homes and most nursing home facilities do try to do a good job, but it's also the lack of personal autonomy, right? So if you think
Scary.
about it, you're reliant on somebody else for everything. So it's not a good quality of life, And so, but people don't think about it till they get there. They just say, I don't want to go. I don't want to go to rehab. I want to go home. They want to go home, but it's like, I can't send you home because you can't even stand up on your own. You
I mean,
understand what I'm saying? And so,
yeah.
so we have to figure out, we figure out a plan, and we figure
So
out
is
something that
part of
works
what
for
you're
everybody.
saying is that if someone's listening to this, that's 30, 40, 50, if you don't want to go to a home, start today building the lifestyle.
100%.
Is
Absolutely.
that the
And
idea? But that's
nobody's,
counterintuitive
yeah,
because
and
I'm thinking,
nobody's
oh, I got to do this, I got
forcing,
to do that.
right, right. Think about, and the other thing is, like, we atrophy as we age. After the age of 40, we really have to be diligent and intentional about maintaining our muscle mass and maintaining our strength. And so it is it you can have a rapid decline in muscle mass and strength if you're not intentional and diligent about maintaining it.
Really?
So it's only a matter of time where you might have something that happens where now you're compromised. And so that is one of the most, in my opinion, one of the most I wish I had some kind of magic wand to make people realize. One of the things I wish I could do is take people with me in the hospital and visit these patients that can't get up out of bed, and so, because just to kind of, because I see it every day, right? Most people don't see it
Mhm.
every day. They may have seen a grandparent or something like that, but um
Yeah.
it's hard to conceptualize and take it seriously if you don't see it. And so that, to me, again, that's kind of my bias, is muscular strength, because I see so many people with so much frailty and weakness, and so many problems because of that. I mean, I could literally go down my list from the hospital today and just name off case after case after case after case of this. Um, and so yeah, it keeps you in the
How,
hospital longer,
how
if
do
nothing else, and then most people end up having to
how
go
do
to
how
some
does
kind of
someone
rehab.
build strength? Is the idea work out 3 times a week, 4, 5?
So 3 times a week is usually pretty sufficient for at least maintaining muscle mass. And it's individual for everybody. It depends on what your goals are. And then the ideal. So I prefer to train for hypertrophy, which is muscle mass, muscle size. And the reason is, typically strength follows hypertrophy. You can train for strength, but there's a couple problems with that. You typically have to have uh, a higher weight and a lower rep range, which, especially for a novice lifter or somebody like that, or somebody that's not like more of an athlete type of person, there's a higher risk for injury. So I think a lower rep range tip, just in general, and I'm talking, when I say a higher rep range, I mean, somewhere around average of 10 reps, 10 to 8 to 15 reps, somewhere in there, depending on what exercise you're doing. That's very, very nuanced, and that's very individualized. So I don't want to sound like I'm making broad statements, but essentially, training for hypertrophy is going to help preserve that muscle mass as far as, the overall strength and longevity component goes. So that's my bias, and you can do that with 3 times a week. You can do that training 3 times a week, but you do have to focus on all the principles of doing proper technique, and how many reps you're going to do and how many reps in reserve and all those things. So, for example, there's typically the optimal range for hypertrophy, again, for muscle growth, is about 10 to 20 reps per muscle group per week. And then you can break that up however you want to.
Okay.
It seems to work a little bit better if it's done, twice a week. So the optimal rep range for say we're just talking about legs. The optimal rep range would be about 6 to 10 reps, not reps, sets.
Okay.
Yeah, sets. 6 to 10 sets per session, per workout session. So some people might do that twice a week to get up, but like three times a week you can do a push pull leg day and maintain pretty well and stave off frailty.
Counterproductive for I'm working from home and I'll go down and I'll do I'll do like I'll walk on the treadmill on incline, and then I'll go do I'll do 10 reps of squats and a set of military presses and set of push-ups, and then I'll go back up and work, and then a couple hours later I'll come down again and do something like that.
I don't think it's counterproductive. No, I think anytime you're putting strain on your muscles and strain on your bones, because the other benefit of that I didn't talk about of resistance training is bone mass and bone density. So it actually improves when your muscles pull on your bones become stronger. Your bones they break down the old brittle bone, they lay down new bone, and they're continually remodeling, and it prevents or reduces osteoporosis. So any muscle so even if you're not training optimally and you're still doing some resistance training, you're getting some benefit. So it's definitely not counterproductive. Instead of me destroying
my totally, like when I was a bodybuilder, I used to, that was just like 3 hours of grueling
split,
work. Yeah. So I'm not doing that anymore.
You don't have to
work out. I'm not working out like that. So
right.
But if I'm home, basically almost every day, I'm doing some level of exercise. There'll be some days where I'll work out 3 times, but it's for like 10 to 12 minutes or 20 minutes. And I might do legs. I might do squats and push-ups every day all week, but I'm not doing an hour of squats every day. It might be just 2 sets. And so you're pull-ups, push-ups kind of. What do you think of that?
I think that you are definitely it's better than nothing. So you are definitely putting strain on the muscle. You might not be building muscle. It might not be optimal. It's probably not optimal for muscle growth, right? If that was your goal, it's probably that routine is probably not what's optimal for muscle growth. You may be able to maintain that way, and especially because you're still young too. So as you age, you'd have to be more intentional about how you train for those goals too, right? Right now, you're young. You already have a fair amount of muscle mass from those days when you were younger and you were bodybuilding. That's a huge advantage for the future, okay? Because we lay down a lot of our muscle when we're young. So actually, you've got a big advantage. So you may be maintaining. It's definitely better.
I haven't taken it seriously in years, and I look like shit. Let's just be real. It's crazy. I'm just like, what's happening? It
would be pretty easy.
Terrible.
If you got, it would be pretty easy for you to, if you got under the right, instruction, it would be really, really easy for you to, especially if you just wanted to change up the aesthetic just a little bit. And not, if it's not,
Yeah, it
listen,
would be less fat would be a goal.
yeah, it
It's
would be pretty
crazy
easy to
how
do
your
that. Like
body
we could,
changes. It's
yeah,
amazing how if you don't use it, you lose it. I just like to say that. It's like
absolutely.
from 12 to 25, bodybuilding was that, and it's amazing how
Yeah.
much work it takes. It's even more amazing how much work it takes to be in a strong aesthetic when it's not your career. Because now
Yes.
I'm not in the bodybuilding community, nor do I own a gym or consult in that space. It's culture. So now it's just like,
But there's one of the things that I really like to focus on, and get excited about, is helping people that are busy professionals, that this is not their career. Because if this is your career and you're doing this all the time, that's one thing. But what if you want to be, what if you want to have a decent aesthetic, but you're a busy executive? That is still possible. There's still lots of things
are
to
you
do.
sure? Is it
Yes,
really possible?
it really is, because it doesn't take that much time, and really most of it's your diet. And so you can do a lot of different things from an exercise standpoint. Because let's be honest, I'm not saying that lifting weights doesn't improve your aesthetics. It absolutely does.
It
And it
definitely
does
doesn't
change your
give you a
body
six
composition.
pack.
No, I mean, you have to lose the fat.
Yeah, the fat is
Yeah,
in the way. And then you're talking about
yeah,
eating out and being on the road 200 days a year and eating steak dinners and all these things. We got to do an episode just on what to eat when you're on the road,
oh yeah,
because our listeners, they're trying to make it in the world. Not
yeah.
just me. I know that they're trying to make it.
We could probably do an entire episode just talking about, how to, some of the core fundamental things that you want to do as a busy professional, maybe somebody that travels a lot, to maintain, because it really is easy to just, for things to kind of get out of hand when you are traveling and you're eating out and you're having dinners with clients, and maybe you're having some alcohol and you're getting to bed late and you're traveling and you're jet lagged and
Do you think
you're
it's
going from
helpful
one
that
side of
I
the
don't
country.
drink alcohol?
Definitely. Yeah, absolutely. So the best amount of alcohol is to drink is none, obviously.
Yeah, I like that.
It doesn't do anything for you positively from a health standpoint, except just if there's a community, like if this is something that you really, enjoy, a very small amount of alcohol in a social setting could be beneficial for you in that setting. But at least from a strictly health standpoint, it's really best not to drink any
So would you
alcohol.
be open to coming back and doing an episode on basically core fundamentals to maintain while traveling on the road as a
Absolutely, yeah, we
busy
could definitely talk
as a
about that.
busy
Yeah,
executive type?
I could give you a few things to do from a dietary standpoint. I'll call this subtraction by addition. If you get enough protein, fiber, water, and fruits and vegetables, if you focus on getting enough of those things in, you're going to be hard pressed to overeat. And some
That's a
people like
big
to use,
deal.
yeah. So protein is, some people say 1.7 grams per kilogram of body weight, or a gram per pound of body weight, or lean body weight. Like if you're considerably heavier, you might just do a gram per pound of like goal body weight or something like that. But so you want to try to get as much protein in as possible. And then fiber is another big one. Here's what fiber does. Fiber not only fills you up, it also feeds your microbiome, which we didn't get a chance to get into, but your microbiome is extremely impactful on your health. So fiber, so protein, fiber, water. Drinking, I would say 2 to 3 liters of water a day is helpful, and just to try to stay hydrated. And it also kind of fills you up, and you're also peeing so much you don't have time to eat.
Wow.
But that's just a joke. But then fruits and vegetables. And so if you're focusing on getting those into your diet, then you're going to be hard pressed to overeat. The other thing is you're not going to be so hungry that you have a food emergency, because these things they last a while, and and planning ahead matters too. Planning ahead, being intentional, there's factors in that, and that's where coaching comes in. And if you get an expert that can kind of give you some tips and stuff like that.
Well, let's do this. I got a Big Mac that's calling my name. I'm just kidding. I'd love to have you back on and talk to break that down if you're open to it. What would you say is a final word, a piece of advice for our listeners on this episode, based on where I guess the foundation that we set here, if I'm correct: bodily movement, cardio. Don't just look at it as the calories, but look at it as a cardiovascular health plan, lifestyle, and resistance to combat frailty. What would you say is the last piece of advice for this episode?
What I always say is I say exercise. We talked a lot about exercise. We didn't talk much about the other core four. We didn't talk much about sleep at all. We talked a little bit about nutrition, and we didn't talk much about mental health, but those are what I call the core four. Of really moves the needle and changes things, and can really make a big difference that everybody can do. From an exercise standpoint, we talked a lot about exercise. I say exercise is the magic pill. If you could put the benefits of exercise in a pill, it'd be worth $1 million a pill, and people would pay for it. But we don't do it. And part of the reason is because it's really hard for us to conceptualize all of the benefits. And even it's cognitive dissonance. It's just hard to even grasp it. But if there's one thing you could do, is start exercising for your health, and stop worrying about exercising for any weight management. Weight management is primarily done through what you eat. And then of course, there's a whole lot of other factors that we didn't get a chance to get into, but yeah, that's what I would say. Exercise decreases your risk of cancer, all the things that, all the diseases that we don't want: cancer, heart disease, stroke, dementia. Those are all our risk is significantly reduced by exercising. And it's not just because of weight, it's because of the molecular signals that happen and all of the different dynamic metabolic changes that happen in our body during and after exercise. So I would say, exercise for longevity is one of the key components of it. And if you can focus on it from that standpoint instead of just trying to burn calories, I think it'll be much more enjoyable and sustainable.